the science of back pain has changed heaps in the last 5 to 7 years, and that science has been mainly done by a couple of researchers, a orthopedic surgeon and a neuropsychologist, both based in Adelaide, and the work they've done has been phenomenal. It's turned our concept of what pain is, and in particular what back pain is, it's turned that concept completely upside down. So the main thing that has really been proven beyond the shadow of a doubt is that disc bulges are an outdated diagnosis. Disc bulges are not a meaningful cause of your pain. Even if you've had an imaging, an MRI, that shows you have a disc bulge, the chances of that being the cause of your pain are very, very small. So let's get back to the science, let's get back to modern science and what really back pain is about. There are 5 places that back pain comes from, and only one of them is actually from your back. So the first one is what we call the posterior chain, and that involves the calf, the hamstrings and the buttocks. The second one is the anterior chain, which is quads, hip flexors and abdomen. Yes, an over-tight core can pull you forwards and cause back pain. The third one is the sacroiliac joint. That's not the spine itself. The spine is here in the middle. The sacroiliac joints are right there on either side. That is not your spine. That is not a cause of back pain. Then the fourth one is when we get into the back itself. Of course, there are lots of structures around there, including muscles, that can cause back pain. The fifth one is the brain, and I'm not going to go into that one in detail, but any pain that has been there for more than 3 months, the brain starts playing tricks. This is not the mind, this is not psychological, it's just something physiological that happens within the brain. So, if you or someone you know has back pain that keeps coming back, then please get them to come to Reach Health or to contact us for a chat at least, so we can really get to the bottom of a true, meaningful diagnosis and resolve this problem for you. Hi, Boaz here from Reach Health, and continuing our series on back pain, today I'm going to be talking about something called the posterior chain. Now, a lot of people think that disc bulges are a serious problem. It's now been absolutely proven that disc bulges, 83% of the time, that's massive, are not relevant. This has been shown in MRI findings on normal people. So, what is going on for the back pain then? In some of our other videos in this series, you'll have seen us talking about the front. Today, I'm going to be talking about the back line. This is particularly true when people think they have sciatica. However, the pain isn't necessarily coming from the back down into the buttocks, the hamstrings and the calf. It can often be coming completely the other way. This chain runs from the sole of the feet, right up through the calf, into the hamstrings, into the pelvis and the buttocks, and all the way up the back, even to the back of the head. So by treating the areas that are the tight areas, often the calf or the hamstrings or the buttocks, we can resolve what was sciatica. So I hope this was helpful for you. If you do know of anyone that has sciatica or back pain, please get them to come and see us here at Reach Health so that they can get a meaningful diagnosis and we can get them some results. Thank you.
Hi everyone, Mel from Reach Health here. So next in a series of videos on back pain, I want to chat about some muscles that aren't typically associated with back pain, but these are your frontal line muscles. So primarily they are your abs, your hip flexors, quads and adductor muscles. So what this chain of muscles does when it's in dysfunction is essentially it creates constant pull into forward bending. So you end up like that. So what that does to your typical muscles we associate with back pain, being the ones either side of your spine and your glutes, means that their workload gets doubled. So they get put on stretch because you're bent forward. They also have to work all day, every day just to keep you upright. And then they also have to do their normal load of stabilizing the back. So as you can see, this probably leads to a fair few issues. This has been Mel from Reach Health. Thanks for watching.
Hi guys, Tom from Reach Health here. Today I want to talk to you about a really common cause of back pain that is so often misdiagnosed, and this is your SIJ joint. So the SIJ joint is the joint just between the buttocks right through here. So it's not your spine, but it's your between your buttocks. That area there is really responsible for holding up that stability within the pelvis, the hips, and the lower back. So commonly, we tend to injure it with just the simplest of actions, such as just picking up an object down on the ground like that, and that strains that whole area. We often think that's the back, but it's actually the actual SIJ joint. So today I want to show you a really good exercise that will help stretch that whole area out and try and relieve your back pain. So, sitting on a chair, just like that, what you want to do, bring one leg up, bring it onto your opposite knee, both hands just trying to hinging from the hips and just trying to reach down. You want to hold this stretch for about 30 seconds or so until you feel a release through the bottom. Hi guys, Tom here from Reach Health. Today I want to talk to you about back pain, and in particular the rare cases when your pain is actually coming from your back. So there are three structures within our spine that can cause back pain, but a disc bulge is almost never one of them. So if someone's told you that you've had a disc bulge and you're still continuously getting back pain, then this video is for you to consider. So there are three structures within the spine. First up, we have our facet joints. These bony structures right through here, they help each of these spinal segments to move individually. Second, we have our ligaments. They help support these joints to keep them stable. And lastly, we have our muscles surrounding the spine. They help support the movement and stabilize our back. So any one of these three structures can cause severe pain, but they are not your discs. When these areas get irritated, our muscles start to guard up and spasm, resulting in any movement to be painful and really scary. At the end of the day, they're not damaged. They're just a little bit grumpy and irritated. And in most cases, in the right hands, they can be treated really well. It is now proven that when a health professional gives a scary and often wrong diagnosis, like a disc bulge, can make our problems even worse. This fear puts our system in overdrive, which causes even more muscle guarding. Here at Reach Health, we keep up with the latest research and evidence for back pain to ensure our clients get the best understanding of their problems and the best success rate of resolving it.
Hi everyone, Mel from Reach Health here. So next in our series of videos on back pain, I want to talk to you about the component or the role that the brain plays in back pain, and really any pain. So, first of all, what we want to make very, very clear is that we're not saying that your back pain is in your head. What we are saying is that the pain, the sensation that we experience as pain is not always a literal representation of damage within the body. What that sensation of pain is, it's a warning system. So that warning system is based on the input that the brain is receiving from the body, but also your exact circumstances at that time and also past experiences of pain. And when we're talking about ongoing back pain, it's those past experiences that are the really relevant ones. What the brain does is each time you have an experience of pain in a particular area, it dials into that area and becomes more and more aware of what's going on. So if we have repeated episodes of pain in the back, the brain becomes hyper aware of that area and the threshold for those warnings gets lowered. So what that means to you day to day is that the experience of pain in the back may not be a true representation of exactly what's happening at a tissue level. So the takeaway message is that pain doesn't always equal damage, and that the brain is sometimes lying to us when it comes to pain. This has been Mel from Reach Health. Thanks for watching.